Hello, welcome to NYC Health and Hospitals Kings County YouTube podcast. I'm Maria West, Director of Mental Health and Substance Use Services. Today, I'm here with Dr. Dreamer, our primary care doctor and addiction medicine specialist, and we're going to be addressing the impact of the opioid crisis. Welcome, Dr. Dreamer.
Thank you.
Okay, Dr. Dreamer, let's talk about the impact of the opioids crisis, and let's start from the beginning. Talk to the audience about opioid. What are opioids?
Great place to start. Opioids are a broad class of psychoactive substances. Most are derived from the opium poppy plant, and some of our essential medications are opioids: morphine, fentanyl, oxycodone. Some of these are even on the World Health Organization's list of essential medications.
So let's talk a little bit about the evolution of the prescription of opioids in the U.S.
Okay, sure. So I think most listeners are familiar with the name heroin, and we think of heroin as a dangerous drug that's available without a prescription on the street. Heroin was actually first made by a chemist in 1874. I'll just say that in the 1990s, oxycodone, OxyContin was formulated and pretty aggressively marketed. You know, there was this notion that we had these great, safe, new medications for managing pain. Pain was the fifth vital sign, as important as your heart rate or your blood pressure, and not treating pain was considered close to malpractice. You know, having these new medications was supposed to solve that problem easily and safely. Primary care doctors like myself across the country were reached out to and aggressively encouraged to use these medications and made to feel like they weren't doing their job well if they didn't treat people's pain. We know now that led to a lot of problems.
And all of those problems came with the opioid crisis, overdose, and all of the deaths and all of the information that came afterwards. Now that we know that those are a problem, what are some of the legitimate medical uses for those medications, and how do we manage that now?
So as I mentioned, a number of opioid medications are on the World Health Organization's list of essential medications for the treatment of pain. For managing acute pain, so someone has a fracture or a serious accident and has serious injuries, after someone has an operation and has large surgical wounds, these are essential medications for really managing that pain. We don't have other things that do anywhere near as good a job of that. What we also know is that for treating longer standing pain, what we might call chronic pain, the opioids are not any better than other medications we have. And I generally avoid them and recommend avoiding them for managing chronic pain. It's been a challenge to make that adjustment. It's been a challenge to figure out what else we have and what else can be used. Usually try to use a combination of 2 or 3 or more medications that work in different ways to manage pain, and try to avoid things that could be habit forming, could cause dependence, could cause problems.
What are some of the risks associated with opioid use?
I would say the most important risk is overdose and death, and we are still in the midst of an overdose death crisis. Last year, there were over 80,000 overdose deaths in the country.
Those are avoidable with education. So we know that those deaths are avoidable if people are actually being aware of opioids and some of the side effects. So what can we do in terms of treating people who had, 1, experienced an overdose, and 2, need to use an opioid as a pain management or post-surgery medication?
Good question. So when it is necessary, or when it's sort of most beneficial to use opioids to treat people's pain, I think you have to be as careful about it as possible, both in terms of use the lowest dose you can to manage the pain, and using these medications for the shortest period of time that you can in order to manage the pain, and certainly educating the patients about the safety of the medications, alternatives to try along the way or to use in addition along the way are all important points. In terms of people at risk for overdose, some of those are patients that we prescribe medicines for pain, and educating them about that risk, and certainly not to use more than we've recommended they use, is important. The larger group of patients at risk for overdose are the patients who are using the medications recreationally and have developed opioid use disorder. For those patients, there are treatments available. We're sitting in an opioid treatment program recording this, there are effective medications, methadone, buprenorphine, naltrexone, that can treat opioid use disorder. And the first two of those do a lot to prevent overdoses as well.
So an opioid use disorder, by definition, tell us about that so that the public can just have a little better understanding.
Yeah, that's an important thing to clarify. Thanks. So an opioid use disorder is a medical condition when use of opioids gets out of control. A severe opioid use disorder, I would say, is synonymous with what we think of as addiction, although that's a loose term. Really, we're thinking about use that you can't control, use that despite recognizing harms associated with the use. Those can be harms to the body, eroding relationships with family, with friends, making mistakes and problems with work or school, and sort of ways that your life is affected negatively by the use. And really the use of the opioids kind of taking over sort of the important parts of your life.
And a lot of the individuals who have or is diagnosed with an opioid use disorder are the highest number of people in the population with overdose. Some of them fatal, some of them non-fatal. So what are some of the more useful medications to treat the opioid use disorder in this day and age that is working, and the role of naltrexone?
So there are 3 approved medications for treating opioid use disorder. One of them's been around since the 1960s. It's methadone. One has been around for this use since around 2000. That's buprenorphine. And then the third one you mentioned, naltrexone. It may be confusing, but the first 2 are opioids. So you're treating an opioid use disorder with an opioid medication. What makes it a good medication is that it stays in your body a long time and kind of provides a stable effect rather than an up and down craving, dysphoria craving pattern again. So it sort of stabilizes the use, prevents withdrawal, which is a big incentive to keep using, because withdrawal can be really unpleasant. So these are medications that are opioids, but kind of normalize the pattern of use. And because they're in your body all the time, they make it so your tolerance is relatively high and makes the likelihood of an overdose much less. A little more about buprenorphine. What makes it an appealing medicine is that it binds in your body to the receptors in your brain really tightly, and that does additional protection against other drugs were you to take them and reduce the risk of overdose. Naltrexone doesn't really prevent overdose because it isn't an opioid and doesn't protect against overdose in quite the same way. It is a treatment, and as long as you're stable in treatment and not using other opioids, you are safe. If you were to stop using the naltrexone, you wouldn't have the tolerance that you would from the other drugs, and you would be at risk for overdose. A very similar medicine to naltrexone is called naloxone. It is also a blocker, and that's a medicine we actually use to reverse an overdose. Narcan is the brand of that. It's marketed as a single nasal spray, and we give out reversal or overdose rescue kits to all patients in our treatment center and really to anyone who wants one, because the more of them that are out there in the community, the more likely someone will have one when someone needs one.
And that really is one of the most important tools in the crisis with the opioid overdose crisis, that it's now available at the gas station, every corner, wherever you go, people are giving out naloxone. And one of the things that I think is more important than all of this is the education and how much people are aware of what's going on, how to identify when they do have a problem, and actually seeking help and treatment. Research has shown that more than 90% of the people with an addiction or opioid use disorder are not in treatment. So I have one more question, Dr. Dreamer. What is the importance of all of these changes, new medications, buprenorphine, Suboxone, Sublocade, all the different versions of treatment that we have today? How do we help combat this overdose crisis? How can we get those medications to patients?
It is challenging. We know that most people, it takes them years between developing opioid use disorder and getting into treatment. It is I would say perhaps the public health crisis of our time, and as much public education and information that we can get out there, the better. There's still a lot of stigma associated with addiction and drug use, and anything that can be done to normalize that and to put safety and health and wellness first, I think is important. So, big picture, communicating that and changing the script there. On a smaller level, making our resources and making our treatment more available to kind of change the conversation and value life and safety over sort of the shame that's typically associated with drugs.
And just to note that some of the medications for opioid use disorder are very highly regulated, like the methadone, which has to be done under very strict rules from the federal government. And buprenorphine, on the other hand, is another really viable option where there are not that many regulations and they're more readily available from every primary care. So that really is one of the more important resources to combat the opioid crisis. And I thank you very much, Dr. Dreamer, for sharing all this information with us, and hopefully someone in the public can hear this podcast and get some kind of services somewhere in the community.
Happy to be here. Thanks.